It's 1:30 now, so we're going to get started with this afternoon's webinar. Good afternoon, and thank you for joining us at the Strong Center for Developmental Disabilities. We're going to be presenting today on a recent community needs assessment that was conducted. But before we get into it, I just want to make sure that I can be heard. So if you are on the call and are able to just unmute yourselves and give me a, like, yes, I can hear you, that would be really helpful.
Yes, I can hear you.
Okay, fabulous. Thank you so much. I appreciate that. So welcome. My name is Susanna Idarola. I'm a psychologist at the Strong Center for Developmental Disabilities, here with my colleague Jennifer.
Hi everyone, my name is Jennifer Ward. I'm a project coordinator here at the Strong Center for Developmental Disabilities and work on evaluation as well as our recreation projects and communications.
Great. We're looking forward to talking to you more about our community needs assessment. Before we get started too, we'd also like to thank Derek Smith, who is in the room with us and also with us virtually. He is providing technical support and assistance, so feel free to chat him if you have any issues during the course of the webinar. And just so you are aware, this is being recorded so that it can be archived and others can have access to the information in the future. So, if you're not familiar with the Strong Center for Developmental Disabilities, we are what is considered a University Center of Excellence for Developmental Disabilities, or UCEDD. There are 67 UCEDDs across the country, including 3 in New York State, but we are the only one upstate and in the western part of New York. We receive federal funding through the Administration on Community Living to provide a lot of education, advocacy, information dissemination, and interdisciplinary training related to intellectual and developmental disabilities. And the Strong Center for Developmental Disabilities is affiliated with Developmental Behavioral Pediatrics at the University of Rochester. However, we do serve across the lifespan at SCDD. We'll share a little bit about our needs assessment process. So this was conducted as part of a multi-year needs assessment that was used to inform the development of new programs, basically, for SCDD. So community input is very important to us to make sure that the programs and efforts that we introduce and those that we maintain over time are aligning with what is wanted and needed within the community. And so we engage in ongoing needs assessment processes through qualitative research, through community conversations, through formal and informal focus groups and discussions, both at the university and then in the broader community. And we wanted to kind of do this particular needs assessment as a capstone to all of that information to provide a last opportunity for the community to provide input into our planning process. So we're hoping that this really helps us integrate community voice and concerns into all of the new programs that we're proposing. And it also allows for kind of this multi-directional learning among all of our community experts, including self-advocates, families, and providers and representations from organizations and agencies. And throughout these, when you have all of these different diversity and perspectives, it allows us to be more innovative in our planning as we move forward. So we'll look forward to sharing the process with you. We'll also talk about the findings and then talk about how that information was used to propose new projects. For this particular part of the needs assessment, it was conducted through Strong Center for Developmental Disabilities team members, and we focused on the period between June and October 2018 to start our planning process to identify how we would want to reach out and who we would want to reach out to. September and October of 2018 was our big push for data collection. And then, as I said, after that, we've integrated the findings with other data that we've collected across the years. And for this particular needs assessment, it included data that was collected via focus groups and then also online survey data. And we'll be talking about both of those individually today. So we'll start with the focus group findings and also talk a little bit about the process. So we conducted community conversations, 4 of them, and we tried to be somewhat representative across Western New York instead of just focusing on kind of the greater Rochester area, which is, you know, more accessible to us. So we conducted these groups across Western New York in Bath. We had 2 in Rochester and then 1 in Buffalo. And we tried to offer daytime and evening times both to accommodate stakeholders who we know have very busy schedules. We had 18 participants who participated in these focus groups, and that represented a combination of self-advocates, family members, and also professionals. And we didn't hold separate groups for each of these. So the groups themselves were more organized around the region, and then they were mixed among who attended. That gives you a little bit of an idea of the geographic distribution that we represented in this needs assessment. And just so you're made aware, we also made participation in the focus groups available via Zoom so that those who were unable to travel could still participate. The focus groups were guided by conversation guides. We were asking about individuals with developmental disabilities across the lifespan and asking about barriers to both in terms of services and overall quality of life for those individuals. So what are the barriers to those things? What are the facilitators to those things? And then directly solicited the biggest needs from our stakeholders, as well as any ideas that the stakeholders might have for future project development. And the same conversation guides were used across all of the focus groups. They included some general open-ended questions as well as some follow-up probes so that we had some systematization of how we approach the conversations, but we were also allowed to be flexible and kind of follow the conversation wherever it went. Okay. I will just make a note that our Strong Center for Developmental Disabilities has what we call 4 focus areas in terms of the topics that we choose to focus on in our programming. And so those are education, recreation, health disparities, and employment. And so we're organized the themes from the findings of the focus group around those focus areas. And then we'll also talk about themes that came up that kind of fell outside those focus areas, just to orient you. So within the education realm, and this speaks to education within the educational system, but then also related to kind of broad community education as well. And it was that community education that really shone through in our conversations, particularly with parents. And there was this overwhelming feeling of a lack of community awareness about disabilities and how that lack of awareness fuels stigma related to disability. And so a lot of parents shared experiences about perceiving stigma in public, about perceiving stigma within their families, and how this contributes to ongoing stress. Families also talked really articulately about how there's kind of a cycle of stigma wherein you have an adult cohort that doesn't really understand enough about disability, and then they are unable to pass information down to their children. And so children with disabilities then are surrounded by peer groups that also aren't well versed in disability and the range of abilities and diversity that their friends could show. And so people really talked a lot about how it's hard to teach your children about disability when you yourself are unaware. And so education was really identified as a need both for adults and for children. Within the educational system, there was a lot of discussion around inclusion and inclusive placements. There were perceptions that there are limited inclusive educational placements or supports available in schools. And so families discussed how sometimes they felt like in order for their child to have the appropriate support to the level that they needed, that made inclusive opportunities restricted to them. And so there was discussion about the need for better awareness and education for those in inclusive educational settings to support the diverse needs of children with disabilities. And within this theme too, related to the educational system, but also more generally within the community, parents were really championed as responsible for getting the ball rolling, but then parents also expressed frustration that they were often responsible for getting the ball rolling to advocate for their child, which creates a lot of, it's a big responsibility for parents, and it takes intensive time and emotional resources as well. So these are our general education themes. And I will share that when we finish kind of talking about the focus group findings, we'll give you all an opportunity to ask additional questions or make additional comments. Within the area of employment, we had a very rich discussion. We had good representation from parents of adult children within the focus groups. And so they were parents to transition age youth who are kind of coming into adulthood. And so naturally, the idea of what happens after high school was very salient for the groups. One of the things that was talked about a lot was the lack of coordinated transition between the high school systems and the adult employment system. So it was very difficult for parents to identify a comprehensive way in which children were adequately prepared in high school for what would be required of them in adult placement opportunities. In addition, parents expressed, and providers also expressed frustration with the variety of barriers to pre-vocational programs. So this came up in a couple of ways. One is kind of the lack of enough pre-vocational programs, so that there's not enough availability or the wait lists are very long. But then in addition, people talked a lot about high eligibility restrictions to different pre-vocational programs. And so if you were an adult who doesn't qualify for support through the state, through Access VR, through OPWDD, who may not be eligible for other programs such as Project Search, you ended up in this no man's land where there were no supports that were really appropriate for you, and therefore you had limited opportunity to engage in pre-vocational and vocational training. And that was seen as a huge gap within the community. There was a lot of discussion about better understanding the impact of employment on benefits for the person with the disability. And so it's a little bit of a balancing act between maintaining your current benefits and making sure that you want a job that pays you well, but if it pays you too much to reduce your benefits, but then that's not enough for you to live on, you're stuck in a difficult situation. And so families often felt like they were responsible for kind of figuring out that balance, and that's very frustrating and difficult for many people to understand. And family perception was that even vocational programs and providers didn't always understand how gainful employment could affect the benefits of the person with a disability. And so the need for greater education on that throughout the community was very much highlighted. And then there was also conversation that mirrored a little bit the conversation in the education system, and this idea that inclusive employment opportunities didn't always have enough support for the person with the disability. And so you ended up having to choose between having specialized supports that may not be available in an inclusive employment environment. And so people felt like there wasn't this balance between inclusion and appropriate supports, and instead people were responsible for making a decision between those things. Those are our main themes within employment. Moving to recreation, and this is an area that has been a new area of emphasis for us over the past 5 years, and so we've been very excited to get more involved in work around inclusive recreation. Limited access to inclusive recreation opportunities was the main theme within this area, and that showed up in a few ways. Parents discussed the frustration with program deserts. So there are certain areas of the state that people felt like they didn't have any opportunity to engage in inclusive recreation. And so this makes difficulties with transportation and also childcare. Who's going to take care of another child in the household if the child with a disability is being transported to an inclusive recreation program? However, there was the additional layer of complexity that even if services are available kind of in your area, even going across town can be seen as a major barrier, especially when you have other children in the household. So if you're taking your 8-year-old to a program and you have to travel 40 minutes to get there, but then the program only lasts 30 minutes. And in addition, you have to figure out what to do with your 5-year-old who may not be appropriate for that program, it becomes not worth it. And that was a phrase that we heard from a few families with respect to inclusive recreation. So it wasn't that there isn't a desire to engage, but more that the barriers kind of reduce their ability to take advantage of existing opportunities. Families also expressed concern about challenging behavior as perceived to be a barrier to inclusive recreation. And so some families have experienced taking their child to a recreation group that they were asked to leave because of their child's behavior. And then other families expressed kind of hesitancy to even go to a recreation provider because they were unsure if their child's behavior was going to be appropriately supported. The need for increased education for recreation providers around appropriately supporting all of children's needs in a recreation environment was definitely a major theme of these conversations. Again, because we had a lot of representation from parents whose children were transitioning to adulthood, the healthcare discussion was also very rich. We heard some of the themes that are fairly common, I think, within our community related to frustration around wait lists. It's hard to get in with specialized service providers, and that's true across the pediatric population and in adulthood as well. But what was highlighted more than we've heard before, at least in our experience, was that it was this difficult transition between the pediatric medical system, in which there were perceptions that there were more specialized service providers who understood the complexities of disability, especially when that person with a disability also had related medical concerns, and that within the transition to the adult healthcare system, there's a significant lack of providers who really know enough about disability, who knew enough about differential diagnosis, and who know enough about treating associated conditions such as mental health needs. And so this was compounded for those adults who also had additional complex medical needs, for example, a seizure disorder. And so that fuels this perception that there's a lack of coordinated care and kind of underlines the lack of knowledge for adult healthcare providers with respect to disability understanding. There was a bit of discussion around how important it is to support sensory needs in many medical settings, and this was highlighted the most with respect to dental processes and vision screenings, which makes a lot of sense. And there are definitely some community programs that were highlighted as doing a very good job with these things, and there was a desire for replication of those kinds of skilled workers in other areas as well. And finally, within the healthcare section, families talked a bit about this relationship between medical providers and parents. And some parents expressed experiences about feeling ignored in visits so that their concerns are not being heard or concerns are being dismissed, and frustration with how information can be disseminated to families. For example, they might receive a report that includes a lot of language that is not understandable or accessible to them. And so that kind of fuels this lack of positive and authentic relationship between families and medical providers. I said that we'd talk a little bit about other themes that kind of fell outside those 4 emphasis areas, and here are some of those themes. Certainly transportation related to a lot of the themes we already discussed, but it was also brought up independently as well. There was a lot of discussion around disparities based on language and culture, and so the need for more culturally responsive providers of all kinds within the community was certainly highlighted, as well as the need for families who have limited English proficiency to be able to access more services within the community and have resources available to them in their own language. Families talked a bit about things like limited residential placements, limited opportunities for individuals with disabilities to engage in self-advocacy programs and leadership and to develop leadership skills in those areas. The need for support for system navigation throughout the lifespan. And certainly a topic that has become even more highlighted since this weekend, the idea of provider shortages in New York State, the lack of gainful and appropriate reimbursement rates for specialized service providers. And finally, families talked a little bit about technologies and missed opportunity within the community for disseminating information and for engaging families. And I'll just let you read for a few minutes or a few moments the strengths that were also identified within the community, because it's important to acknowledge that there were certainly positives that families and providers felt exist within our community. Parents as being the number one asset in terms of their advocacy skills and persistence in moving the needle. It was acknowledged that there are a lot of parent-focused and parent partners programs within the community, including clinical service programs and also research programs. The family navigators at developmental pediatrics at the University of Rochester were much appreciated. Certain providers such as Eastman Dental, who do a great job with individuals with disabilities, were also highlighted, and other programs such as Project Search. Okay. So within the focus group, some ideas for future supports and programs included kind of strengthening and building our community ability to advocate for policy change at a state level, as well as a mechanism for mobilizing legislative advocacy efforts, especially for parents, because legislators listen to parents, legislators resonate with stories of personal experience. And so creating a mechanism to better mobilize all of us within the community around these issues was raised as an area of potential development. People talked a lot about just the need for increased access to and increased development of specific trainings in intellectual and developmental disabilities. But in addition to that, the need for direct service providers to learn more about engaging authentically with diverse families. And then a cool idea that someone brought up was the idea of mobile recreation programs that traveled around, so that if you were in a service desert and couldn't go to the recreation program, perhaps the recreation program could come to you. Okay, so I'm going to take a pause right there and provide you with an opportunity to unmute yourself and ask any clarifying questions or make comments. And if you do have a comment, I would just ask that you introduce yourself with your first name if you're comfortable with that. No questions? Okay, well, we will give you other opportunities to add as we move along. We're going to take a transition. I'm going to transition things over to Jennifer, who's going to talk more about the survey findings.
Hi, everyone. So I am going to provide an overview on the survey that we sent out, give a little bit of details on the demographic information, and then share the findings and the results from the questions that we asked. So our process was to divide the survey into 3 sections. We used skip logic, which means if someone selected self-advocate, they would receive a certain set of questions that was specifically geared towards them. Whereas if they chose professional or agency, for example, they wouldn't be asked about their diagnoses. And then there were 76 respondents total when we created this slide, and we actually gained 3 more by the end. So we had a total of 79. It was mostly white middle-class respondents, which is important to know and, identifies a gap in who we were able to reach. The income ranged from under $20,000 annually to over $100,000 annually, so there was a pretty big gap there as well. And then it was almost entirely female. The majority of the respondents reported their child or themselves had an ASD diagnosis. Other reports were physical disability, learning disability, mental health, intellectual, genetic, and there were some other categories as well. So we will just go through some graphs and charts, and I apologize for how excessive this seems, and I'll just go through and describe a little bit about what's happening here. So this shows a breakdown of county. You can see the big blue box, that's Monroe County, with 48 people reporting that they were from Monroe, which was over 60%. The next county that was predominantly reported was Wayne County, and then Livingston, Ontario, Steuben, Genesee, and it went down from there. So there was only a handful of counties included in the survey. Others reported were 0%. So the predominant responses were suburban with 62%, and then we had the next was rural, which is interesting to note since Monroe County was such a big percentage. So I think that was probably mostly the suburban area, and then capturing that 7% urban, which was the smallest percentage. We just asked if they'd heard of the Strong Center for Developmental Disabilities to get an idea of who was answering this survey, and so we found that most of the people responding, know about us, and that's probably why they decided to respond to the survey. We had 95% female, which was a little bit surprising, but also not surprising since that was predominantly who we had coming to the focus groups as well. 3% chose a category outside of female and male, and then just 1% male. And then we also had predominantly white, as I mentioned earlier.
So we asked them how they learned about services and programs just to get a better idea of our information dissemination and how we are approaching this. This is a little tricky to ask through a survey because we sent it out via email, so people who are responding are most likely to learn about things through email. But we also found a high response of people who use Facebook for information dissemination, which also came out in the focus groups. Parents talked about the importance of Facebook groups in learning about services. So this was interesting to see that in both places. And then there were some other responses in there as well that were interesting, like doctor's offices. Other parents came up a lot in that other category, networking, different meetings, word of mouth. So there's a lot of things happening from parent to parent and through word of mouth, and from agency to another agency, which is helpful to know. And then here it shows the breakdown of the role of who was responding. So you can see the majority were parent caregivers or another family member. And then from there was agency and school personnel, as well as other community organization. We chose to look at that as one big group, but you'll see here it's broken down a little bit more specifically. But that was the second biggest group. And the smallest group was self-advocate or individual with a disability, which we'd hope will increase in the future when we do more needs assessments. We also asked about diagnoses just to get a better idea of the responses that we later asked to learn why they might be responding that way. So for example, ASD was the most reported for family member as well as for self-advocates, and that helps us understand the data a little bit more. We also had learning disability, and there were some other diagnoses that were listed there as well. So ADHD, anxiety, apraxia, global developmental delay. When we asked about the diagnoses for self-advocates, learning disability was the largest response, with mental health and physical having the same level of response. We did want to know if there were certain groups that were being served that particularly needed more services, or that were particularly not receiving good services. So what we found here was that the respondents reported transition youth and young adults were really not being served well, and we saw this again in our focus groups. It is helpful to note that most of the respondents did not have young children, so that kind of sheds light on their answer here. If we had parents of children who were really young, we might have seen a higher level of response for school age and early childhood. But because a lot of our respondents were parents of adult children, that could reflect why that answer was so high there for that group. But it really does show that as soon as they get to that age of the cliff, the services seem to drop, and then there are inadequate services beyond that point as well. Okay, so we asked about our focus areas and how people were feeling their needs were being met in each of the areas. So the way we asked the question was, on a scale of 0, not at all, to 100, completely, how well are your needs being met in the following areas? So for example, a score of 50 would be right in the middle. They're being met adequately, not great, not poorly. So a score of 68 was pretty high, and that was the highest, and that was in health. But the respondents in particular, with reporting ASD as the highest diagnosis, they may not have as critical healthcare needs as some other populations. And then with the high level of income as well, their ability to access healthcare may not be as challenging. The next area that was reported more highly was education, and then followed by recreation and employment. So within all 4 of these areas, none of their needs were being met 100%, which is very clear. But there does seem to be a lot of room for improvement, and that was touched on in the focus group. So it's helpful to see where those specific needs are. And then we wanted to break this down by individual role. So we looked at it from what were family members saying about this particular need being met, what about agency representatives, and then self-advocates, to see if there were discrepancies between their perspectives and their needs being met in each of the areas. So for example, there was pretty significant difference between a family member's experience with employment and that need being met versus what a self-advocate was saying in that area. So self-advocates who were filling out this survey were saying that need was being met to a higher extent than family members who were filling out the survey. And when we asked questions on the surveys, we generally followed up with some open-ended questions to get an idea of what are the specific needs in these areas. So in recreation, we really heard loud and clear that more options and more choice were very important and were lacking. So this goes back to the idea of program deserts. And while there might be one option in a community, there needs to be options in all communities that are accessible to the families who are wanting them. And we also heard that inclusion is really important. There are maybe some specialized options, but families are really wanting inclusive options and those that provide a family experience so everybody can participate in it together. There was also some talk about having opportunities for people to interact with each other in a social way. So for people with and without disabilities to participate in programs together and gain that social experience. Transportation came up in this area as well. For health, this really echoed a lot of what we talked about earlier in the focus groups. The biggest thing that came out here was the need for more specialized care providers and as well as more training for providers in working with individuals with intellectual and developmental disabilities. Another key theme that came out was mental health and the need for more mental health services in the area and accessible in communities. And then coordination between providers. Many people were talking about seeing multiple providers and there was, very little coordination between them. There was also some discussion on insurance issues and not being able to access providers due to certain insurance. Within the area of employment, again, this was reiterating much of what we discussed earlier in the focus groups. What came up here was a need for more training for employers and support staff of employers. And then also one thing that came out was there may be inclusive opportunities in the community or employers that are doing a great job with inclusion, but the community doesn't always know about where those options are or where to find employers that are doing a good job with inclusion. There's also discussion on rural areas and the lack of opportunities in those areas. Agencies and professionals had a lot to say about this and their perspective was a little bit different. They really wanted to work more with businesses, agencies and businesses working together to help individuals gain meaningful employment. And then the last focus area of education, really what came out here again, just like with recreation, was more options, more programs that have diverse experiences for individuals with disabilities. And then again, the transition, the need for transition, and what happens beyond age 21. So what options for education are available after, that 21 cliff drop off. Again, training came up as it did in the other three areas. Okay, so this here has to do with the current needs that were reported by, first we're going to talk about self-advocates. And what we asked was, what are your current needs? So we were just asking them, not what do you feel are the most important needs, but your specific current needs. And what was reported most highly was social opportunities, employment opportunities, and then mental health and transportation after that. It makes sense that they did not report early intervention because we did not have 3-year-old self-advocates or 4-year-old self-advocates filling out this survey. So that wasn't surprising to see that. And then we asked about family members' current needs, and just like with self-advocate needs, social opportunities came up loud and clear, and was really interesting because we did not see that in the open-ended data as much, so it was helpful to see that here. And then the second most reported was inclusive recreational and leisure opportunities, which makes sense. It goes hand in hand with social opportunities. Employment came up here really highly as well, along with mental health.
And it's not that the other ones may not be important needs, but they might not be current needs for that family, because we did ask about the specific needs for the families who were filling it out. Some other responses that were noted here were respite, behavior support, self-care, daily living skills, and residential options, some other things that might not fit into these boxes that families reported. And then we asked agencies and professionals this question, but we asked it in a little bit of a different way because they don't have direct experience possibly with this in their own lives or in their children's lives. So we asked them what they felt are the biggest needs. So this is a little bit different, but some of the same categories came up, which is interesting. The biggest one here that came up was transportation, and then accessible housing, which is interesting to note because those were not reported as current needs for the families and self-advocates who filled out the survey. But mental health came up here again, just like the other areas, as well as employment and recreation, and then social. The ones that were not reported highly were, early intervention across 3 areas, and that may be due to the age groups of people who are responding to the survey and the types of agencies that were filling out the survey. We wanted to get an idea of what caregiver and family needs are and how their needs are being met as an individual and not as their child or their family member. So we asked them on a scale of 0 to 100, how well are your needs being met? 0 being they're not being met at all, 100, they're being met completely, less than adequately was their response, 49 was their average response. And so there's a lot of room for improvement in this area and meeting the needs of family members and caregivers. After that, we asked them about the biggest barriers to getting those needs met, to get an idea of what's getting in the way of you getting from that 49 to 100 to the complete needs met. And the one that stood out really clearly was stress or anxiety. So that mental health aspect and the stress or anxiety of coordinating all of that, all of the stuff that we've been talking about through these findings. Lack of a support system and lack of supports for the family member. So those 3 together were really strong and really relate to each other. And then along with that, difficulty navigating systems. All of these were reported pretty high percentages. None of them were less than 10%, which is important to know. So all of these are strong barriers. In addition, finances and then lack of respite. The other category was kind of related to all these different things, but more specific. So not knowing where to get information, too busy, no time, things like that. It's hard to prioritize what's needed versus what I want. So that self-care component, feeling just skipped over, and then just not having supports for their adult children or transition help. Okay, so that's an overview of the survey. We also created a visual report of the findings that provides a little bit less detail on what we found, but gives a nice overview of the key points. And we can go ahead and share that when we send out the link to the recording. But I wanted to know if anyone has any specific questions. I know that was a lot of data, a lot of charts and numbers, but I hope it was helpful to provide some more perspective on the findings. But please feel free to unmute yourself or ask any questions in the chat box about how we did the survey. I didn't mention, we did use SurveyMonkey, an online link, and we did it all via online email, Facebook. So we didn't have any paper surveys, with the exception of having our focus group participants fill out the survey on paper. We didn't send any paper surveys out to agencies, mostly due to time constraints. But that could be why our participation was so limited to a certain type of population.
Any questions for Jennifer about the survey process or survey findings? Ooh, we have a chat box. Okay. Well, again, you'll have one more opportunity to contribute before we finish today. The last thing that we're going to talk about are how this information was then integrated with our other needs assessment data and used to develop new projects that are being proposed. So a couple of the participants in the focus groups, when we gave them the opportunity to ask questions, what they wanted to know was, how will what I share with you today be used? And I thought that was such a nice question. And so the answer is we use that feedback to guide the proposals for these new projects, which we'll talk about now. I don't know why I'm getting these lines all this time. Okay, and again, we're going to organize this by the different focus areas. So within recreation, I will actually, this is Jennifer's area. So Jennifer, I'm gonna let you take over and talk about recreation.
So the first thing we're doing actually actively right now in this area is submitting an application through the Rochester Area Community Foundation. And we are working on submitting an application around collaborating with the Greater Rochester YMCA and training camp counselors for their summer camp program on how to support children of all abilities and their sensory, behavioral, social needs. And we're doing this through an inclusive recreation curriculum that we have designed and been continuing to adapt. And that curriculum really addresses a recreation program from the administration to again, what I mentioned, like the sensory, behavioral, social needs of the individual. It looks like someone's drawing on our page. It's pretty. Yeah. So that's the curriculum. And we've been piloting it with the children's librarians in Monroe County. We've piloted it with the Eastside YMCA. And we also have some plans to be bringing it to some new sites in the next year and so on. So that's what we're really doing in that area, is focusing in on training and supporting programs that might not be able to provide inclusive options at the moment, but want to be able to, and are just needing some resources and education on how they can start doing that. And we're also working with other organizations in the community, like Rochester Accessible Adventures, who are doing work in this area. The last thing we're working on in specific to recreation is we have the ability to do assessments of organizations and how they're currently operating in terms of inclusion. So it's measuring physical accessibility, but also doing interviews to find out how things are going in terms of the more inclusion aspects. So the social needs, how are those being met? How are you marketing your program? Are people hearing about your programs that are inclusive, and that type of thing? So we haven't done any of those at the moment, but we do have 3 staff/faculty who are trained in doing them. And then the one other area that's related to leisure and recreation in some ways is engaging faith and spiritual communities around how to support all people in their congregations, their faith communities, and really make them inclusive environments of belonging.
Great. Within the area of employment, one of the priorities is really to focus on transition age adults who kind of fall in what I described earlier as the no man's land. So they may not qualify for state services, but may not be ready for fully integrated employment or participation in something like project search. And so through a collaboration with Starbridge and through our Rochester Regional Center, we have been working on developing something called the Employment Discovery Network, which provides direct education to those individuals and coaching to help them kind of go through the job application process and find potential employment opportunities, but also to focus on younger age children who are still in school to help get them and their families thinking about employment as not just a possible outcome, but an expected outcome, so that their transition to vocational opportunities that is planned for at an earlier age. We also are interested in kind of expanding that to families as well, to talk more with families and explore ways to raise family, but also community expectations for employment, so that again, employment is not a pie in the sky goal, but something that's expected for all people with disabilities who want employment, and to work more in the customized employment realm. I will also say that we are available, and we have in the past done trainings on the employer side to help employers better understand how individuals with disabilities can really add and be an asset to their organizations, and how to best support those individuals. Okay, I'm seeing some things coming up in the chat box, so I'm going to just put this aside and I will come back to it at the end, so I make sure that I acknowledge those comments. Thank you. Within health, like I said earlier, one of the things we're really focused on within the health realm is health disparities. And so we really tried to focus projects on engaging diverse populations, not only with respect to diversity of disability, but also those who might claim other marginalized identities. So one way to do this is to look at where disparities exist and see what we can do to support better access to quality health care. A project that has already been in the works but is planned for expansion is this idea of teaching interpreters who will be engaging with families who have limited English proficiency about disability. And so we had a specific project to train Spanish language interpreters on disability so that they would better understand how to engage with individuals with disabilities and their families, but also to provide kind of the cultural perspective on how that intersection of disability and Latinx culture, for example, might affect that individual's experience and make those interpreters more sensitive to how disability might play out in that specific culture. So we'd like to continue that with Spanish language interpreters and also expand to other languages and communities as well. We also have been really interested in responding to community needs around prenatal care for women with disabilities who are pregnant, and kind of expand that also to preparation for parenthood, and then on the other side, family planning and sex education for women with disabilities. We are exploring opportunities to develop trainings for providers, so OBGYN providers who are seeing a lot of women with disabilities in their clinics, around how to best meet their needs and to best make sure that they are understanding all of the recommendations that are being given to them and understanding why they are being given those recommendations. So more of a health literacy focus. Within this area of health, we're also kind of wrapping in this idea of parent and caregiver health as well. For a few years, we've offered an annual parent mindfulness program for parents of children with autism spectrum disorder through one of our state grants. That is available for free, and it's a brief, sometimes more between 4 to 6 session course on mindfulness. And we are going to continue to offer that this spring with the expansion of offering 2 groups, so that we can now offer a daytime and an evening group to accommodate schedules. And so information about that will be disseminated via our website as well as our Facebook page. We are interested in exploring potential racial and ethnic health disparities and how the additional stressors of claiming other marginalized identities might intersect with stress that you might experience as a caregiver. And so we're looking into opportunities to explore those stressors in greater detail, with the hope that it'll help us better understand the caregiver experience and might guide interventions to help promote caregiver wellness. And then finally, in response to a lot of the comments about stigma, better community education on health disparities for individuals with disabilities and conceptualization of individuals with disabilities within the community, particularly underrepresented communities, will be an important part of our work moving forward. And I just saw someone pop up with a comment that may be related to what we're talking about. Oh, okay. All right.
And then the last area of proposed projects is education. We have a number of ECHOs, which stands for Extension and Community Healthcare Outcomes, in the works. And traditionally, ECHOs have been for more of the healthcare model, but we are really working on using more of an education model for what the work that we're doing here at SCDD. So one that is being currently done is an echo autism for educators, but there are some other ideas for additional topics we could cover with educators and administrators. And this would be through similar to like a webinar format, but there's more cross communication and co-learning between sites that you are working with. Another idea that we are exploring is mental health school professionals, because mental health was reported as such a high need. And then again, thinking about what happens after 21, post-secondary education, and really engaging that group and that population through an echo. Another idea is a webinar series for caregivers on the importance of having high and realistic expectations for children with IDD, specifically the importance in areas like education and employment, so that individuals aren't held back because they're of low expectations. And then we also have some ideas on how to assist families in engaging their children with disabilities in the IEP process so that it's led by the individual who it's designed for.
And this would be an important precursor to ongoing leadership training in advocacy for self-advocates. So kind of creating more of a natural pipeline to that kind of leadership for those who might be interested as they age. Okay, I'm gonna take this opportunity just to read through a couple of comments. Okay. So one comment is that the reason that we have a lack of surveys from rural areas is that many of us don't have access to high-speed internet or internet at all. Many of us have to go to the library or McDonald's to have any internet access. So in the future, I think you need to send out paper surveys if possible to those in the rural areas. Thank you for that comment. It's certainly an issue, and we are engaging with families in rural communities in other ways, and have certainly encountered lack of internet as a huge barrier to being able to kind of keep in communication. So we will be more mindful about either mailing things out or going in person and disseminating flyers at the libraries or other locations that people are likely to be. Okay. And another comment about interpreter education. The comment is that the substance use disorder provider community in Monroe County is looking at how best to serve people in the deaf culture. This just started, but I wonder if there's overlap or awareness that can be built. That is a good idea, and I was not aware of that. Jen, did you know about that? Yeah. So this is why these kinds of multi-directional share of information is so important to us. Thank you for the comment, and we definitely will figure out a way to connect with that group. Perhaps you wouldn't mind an email if we emailed you to follow up on that. And then we have another person who tried to unmute earlier, but we couldn't hear you. I'm sorry about that. Who's interested in parent involvement in initiating policy change. Yes, I think that there are so many people who are very passionate and have personal stories to share about this. One thing that you could do in the immediate future is to attend the Advocacy Day in Albany. It's occurring on February 4th. And I can send out, when we send out the link to this recording, as well as the needs assessment visual summary, we can also include a link to that event so that if you're interested in joining, that you have the ability to do that. Okay. So we are coming close to the end of our time, and like we said, this information will be made available to you so that you can continue to access it. When we send you the visual summary of the findings, that is also something that can be disseminated broadly within the community. So please feel free to share with your networks if you think that would be of interest. And we thank you very much for your attention today and for your excellent comments. And we look forward to engaging in an ongoing collaboration and share of information with you.
Thank you, guys.